The COVID-19 pandemic made more widely visible something we in the pharmacy profession already knew. When allowed to provide patient care services that reflect their extensive education and training, pharmacists have a great impact on public health and safety. Since 2020, pharmacy professionals have expanded beyond their conventional medication management and dispensing roles. The community footprint of pharmacy played a role in enabling an immediate increase in access to COVID-19 testing and vaccinations. But it was pharmacist education and patients' existing trust that led to them being tapped to provide necessary treatments for COVID-19 and other chronic disease states. As the United States healthcare system strained under the increased demands brought about by the pandemic, state and federal regulators looked for ways to ease the pressure. Opportunity came in the form of lessened restrictions on healthcare professionals. In pharmacy, we saw some licensing and scope of practice restrictions eased at the state and federal level. This increased patient access and ensured continuity of care for all patients. As healthcare providers, we welcome the opportunity to serve the public in a healthcare role that reflects our extensive education and training. Although pharmacists have taken on a significant amount of additional responsibility due to the pandemic, all the pre-pandemic work and responsibilities did not subside. In fact, with COVID-19 now endemic in the U.S., pharmacists will continue to play a necessary role in testing for, vaccinating against, and treating the virus. Like our physician and nursing colleagues, pharmacists and pharmacy technicians are faced with a volume of work that is not sustainable long-term. As our state legislators and boards of pharmacy move to make eased restrictions permanent, it is necessary to reevaluate the current state of pharmacy practice. With a renewed focus on patient access and safety, we need to eliminate barriers in current state pharmacy practice regulation. We need to provide pharmacists with an improved regulatory model that allows their capabilities and expertise to be fully utilized to serve patients. To create a model that enhances and promotes patient care and safety while exploring a supportive environment for pharmacy professionals, we will be looking not only to those in the regulatory community, but also to practitioners affected by such rules and regulations. We will begin by evaluating the current pharmacy regulatory environment, while considering pharmacy education and other external factors that impact patient safety and access to care. As we work toward developing this new model, we will focus our efforts on three main areas. First, we will identify barriers in existing statutes or regulations that limit patient access to medication and care. Second, we will find opportunities to increase patient access to care by enabling pharmacists to practice to the extent their education and training allow. And third, we will determine the external factors that foster unsafe working environments when delivering patient care. To explore these three areas, a series of task forces are scheduled over the next few months. They will offer solutions to the identified challenges, and reports of their findings will be available in early 2023. I invite you to learn more about these solutions and NABP's ongoing efforts to reevaluate the current pharmacy practice model. As regulators, we must consider the ever-changing healthcare environment and the potential impact on the laws and rules in our jurisdictions.